I was probably about 5 or 6 kilos overweight. Not really significant medical issues, but I just wanted to go down this journey. And before you preach, you got to practice it yourself. And that was my bigger why. And the kind of shift that I experienced, not just in my health and well-being, but the level of mental clarity that I could get was really profound. It was really profound. And that was the time when I was writing this book as well, my first book, Happy Gut, Healthy Weight. And the journey hasn't stopped since.
Hello everyone, I'm Dr Shami, Vice President of ACNEM, the Australasian College of Nutritional and Environmental Medicine. ACNEM has educated hundreds of healthcare professionals, including doctors, for the past 40 years on the 4 pillars of health: diet, sleep, exercise, and environment. And this transforms chronic disease health outcomes. Today, I'm really excited to have Dr Arun Dhir to join the conversation about why nutrition matters in medicine. A bit about Arun Dhir. Dr Arun Dhir is a specialist upper gastrointestinal and bariatric surgeon working in the public sector and also has a busy private practice in the northeastern suburbs of Melbourne. He's an active member of the Australia-New Zealand Association of Gastroesophageal Surgeons, Society of Metabolic and Obesity Surgery, and also ACNEM, which is awesome. He's also a yoga and meditation teacher, and along this journey has nurtured a very keen interest in the area of mind, body, and gut connection, which he incorporates in his practice. He's a strong advocate for a shift in our approach to managing obesity, which we'll go into this conversation today. He's actually written 2 books, Happy Gut, Healthy Weight, and Creating a New You, Health and Wellness Journal. And he's actually onto his 3rd book, Your Mess Has a Message. So I'm really excited to have Dr. Arun Dhir today. Welcome, Arun.
Thank you, Shami, for the kind invitation and for that introduction. Not really deserving of that, but we are all on our journey of learning. And I'm so excited to see you bringing new changes in ACNEM, an organization that I've been associated for a while now, and to see the new shift in the mindset of how the message is being embraced by the wider medical community. So thank you again for the invitation.
Fantastic, Arun. I'd love to start by why ACNEM actually exists, and it's because doctors are not taught about nutrition at med school. So I'm really curious on your journey into nutrition, and especially as a bariatric surgeon, and your interest in the gut microbiome. How did you start that journey? What actually prompted you down this road?
Yeah, well, actually, if I look back, the journey started really when I made a decision as a second-year medical student to become a surgeon, where I had the ability to do something with my hands for the patients, rather than just put pills to work. And during the course of my journey, as we all experience and reflect on when we see patients, you would just see that patients, as they age, they would be on an increasing number of the list of medications that they were on. The separate medication for high blood pressure, separate for reflux, separate for diabetes. And these medications would not seem to go down. They were just going up and up. They were like palliating these problems rather than curing these problems. And surely it was disheartening just to give them prescriptions. And believe me, I've done that as an intern, as a young medical student, as a junior surgical doctor, as we all do. But soon you realize surely there is something more than this that can be done in order to alleviate these problems. As a surgeon, I know, and more so as a bariatric surgeon, I can see the effect that weight loss has got on patients as far as resolution of their comorbidities go, such as diabetes, sleep apnea, high blood pressure, and even in women with regards to, PCOS. We know there is a strong correlation between this. But in answer to your question about my interest in nutrition sparked when I did an experiment on my own self. I was about 4 years ago, I decided to go on long service leave after having served for a little while in the public system. And I worked on a whole process of trying to not only recalibrate my metabolism, but trying to see how healthy and how fit I can get. I was probably about 5 or 6 kilos overweight, not really significant medical issues, but I just wanted to go down this journey. And before you preach, you got to practice it yourself, And that was my bigger why. And the kind of shift that I experienced, not just in my health and well being, but the level of mental clarity that I could get was really profound. It was really profound. And that was the time when I was writing this book as well, my first book, Happy Gut, Healthy Weight. And the journey hasn't stopped since. And I'm so convinced now that it's our diet, our lifestyle, our sleep, all those tenets that you mentioned about ACNEM, they are the key contributors of diseases in our society. And if we are not addressing them, we are only scratching the problem on the surface.
It brings me on to a great question. So, as a bariatric surgeon, what kind of strategies do you implement in your patients? Clearly, you take a different approach. You wrote this brilliant book. Everyone needs to read it. It's so well thought of and it's covering it in a really simple way, so it's easy to understand. But what approach do you take for your patients?
Yeah, see, when just to give you a bit of a background around bariatric surgery was not considered to be a really popular or a respectable branch because people thought weight management is eat less and exercise more. You do surgery to reduce the size of the stomach of these patients. Well, they are, unless they change their lifestyle habits and all of that, they will never get better. Now, I'm talking about patients whose BMI is above 45. These patients are really in need of help. Okay, they've got significant diabetes, they've got significant sleep apnea, they've got issues with their personal hygiene because of their weight. Now, weight loss surgery will bring the shift in their weight. But simultaneously, if we do not educate them about how mindset strategies, how role of stress management, how sleep, how developing a routine for yourself, which is, I often call it a morning hour of power, and self-care. A lot of people think that self-care is, for women, it's like going to get your nails done, get your eyelashes done. Well, that's not self-care. Self-care is really to get to know yourself. Who do you stand for? What are your values? What is it that is your purpose in life here? So unless we at least get a stimulus to think about those questions, we are always just looking for that superficial pleasure. So those, I understand, are deeper questions and probably somewhat out of the scope of this, but I touch upon this because this is the approach that we take when we are looking at bariatric patients. So we talk about surgery on one side, but then the other side, we have a mind, body, and soul-based program, which is after surgery support. That's called the Transformed program. We run it on a Facebook members only group, which is private, so they have got privacy. And we run it as a monthly Facebook live sessions that we do. So my dietitians do it, I do it. We've got an exercise physiologist, a psychologist who does that. So this is bringing a mind and a body connection together, and it's amazing and heartwarming to see how people embrace that lasting transformation. Now, does everybody embrace it? Probably not. Let's be honest about it, because we all have our own priorities. But I feel that even if I can bring a difference in a handful of people's lives who can then go on and inspire others, it's worth a try.
And what was the journey like for patients? Because when they come to see you, they obviously have a different approach. They get a different approach. Are they quite excited? Are they quite relieved? Are they quite shocked because they were just expecting surgery?
Yeah, that's a good question, Shami. And look, I'll tell you, when I was training as a surgeon, my professors and my mentors and my teachers would only talk about surgery and show them the door. It would be a very mechanical, stereotype consultation. But things have changed over time. People expect more. And I'll be very honest, about 5 or 7 years ago, even though I would believe in these concepts of mind body connection, how stress is affecting our weight, But I was very hesitant to discuss this with my clients because I would think, what would they think if a surgeon discusses about stress management? They would think, does he know his craft? Does he know what he's talking about? But then a point came when all these concepts became so clear to me. I was so convinced that I did not need the favorable opinion of others to tell me that I could speak my own voice. And that was a big shift in my own journey.
Amazing.
So that is what led me to tell patients very clearly that, look, I know you have come to speak to me about surgery, and I speak to them about surgery. I tell them exactly what we are going to do, their questions and answers. But then what I realized was, when they hear from a surgeon the impact of stress management on their recovery, on their healing, impact of sleep and their environment on their healing, there is a different gravitas to that, rather than me saying, go and see a dietitian or a psychologist.
Absolutely. And I think your book actually reflects a lot of all of those parts. And I think would it be a great idea for patients to start reading that book before they want to come and see you, just to get an idea of how you work?
Well, we give them a copy of my book as a part of the after surgery support program. So get a copy of the Creating a New You, which is a health and wellness journal, because I truly believe that journaling is a very good way to create new psychoneuromotor circuitry in your brain for new habits. Because at the end of the day, I am big on creating lasting behavioral change in individuals. Nothing changes until there's a change of behavior. Regardless of whether you have as many number of procedures or pills, if you don't change your behavior, nothing will shift.
Absolutely. And what can we expect from the happy gut, healthy weight?
So I wrote this book with two things in mind. Number one, I was never in favor of trying to be salesy about taking probiotics. I would get so many, especially women, coming to me, oh, we are on this expensive probiotic. What do you think about it? Now, I go back to this quote, which is a quote from the ancient Ayurvedas, that, if the diet is wrong, medicine is of no use. If the diet is healthy, then medicine is of no need. And I truly believe that. Being a yoga meditation teacher myself, I realize you may be eating the most expensive supplements, but if you are not eating with that sense of gratitude, with that sense of appreciation, because mind you, stress response has a huge bearing on how we process all of this. And I think that's where bringing in practices of, just sort of deep breathing, because we know that breathing calms you down. Practice of yoga. Now, yoga, people think, oh my God, I'm not able to move. How can I do yoga? Well, yoga is mind body exercise, which brings you more awareness in the current moment, and allows you to connect with the sensations or the symptoms that your body is experiencing. And that's how I look at it. Yoga can be done sitting in a chair as well. It's as simple as that. It doesn't mean you have to do a headstand. So this is just one means of, relaying this information to it. Because when I met some of the yoga teachers who were my mentors, this is exactly what they said. Use it as a tool to create awareness. That's the bottom line, creating awareness.
So I'd love to see how you compare from how you were practicing many years ago to how you're practicing now. The success that you see in patients, is it pretty obvious that patients are, and like what you said, sustaining their goals rather than relapsing? What do you see, Arun?
Correct. So I'll I'll answer this in two ways. One is, Shami, we got to understand that there may be personal biases. When I look at it from a more scientific and a more objective assessment, that there may be a personal bias that my results are better than somebody else. But that is the reason why we do studies. So we are currently doing a research study with La Trobe University microbiology department to assess the change in the gut microbiome after gastric bypass surgery. It's an ongoing study. We are currently recruiting, and we have already recruited some patients. So it is basically they're getting their poop samples, which we take prior to surgery, and then in 3 monthly intervals after surgery. We are specifically studying the gastric bypass surgery because the gastric bypass creates the maximum shift in their metabolic and in their microbial profile. So that is one way of assessing it. The second way of assessing is the feedback that you get from patients. And I think that is very important too. And I'm not saying just good feedback, I'm saying good and bad feedback. You got to put things into perspective. And I think it is very important that when we become passionate about what we do, we put our heart and soul into it, we realize that we then have the ability to create a shift in somebody else, or we can at least inspire to create a shift in somebody else. That was a great learning for my own self, because prior to that, I was just like any other doctor, would go to work, do my procedures, see the patients, check their wounds, and goodbye. That was all. And but I think when we become passionate, we realize that we've got a higher purpose than just that.
And that kind of leads me on to my one of my final questions. How does it feel as a practitioner to practice the way you are practicing?
Look, it feels very fulfilling, Shami, and that's what I think all of us are seeking. At the end of the day, I feel as medical practitioners and healthcare providers, we are really blessed, because we've always had a need. There's always been a demand for our services. But I think it's the element of fulfillment, which is when it is missing, it leads to things like burnout in our profession. Burnout is a big thing because we are going day in, day out, doing the same thing, which is why when my colleagues meet me or they talk to me, they are hearing that I'm doing some books. I'm going to be doing my first health and wellness retreat in November, which is where we do a weekend retreat in a very concentrated fashion. We bring in, I used to run this radical wellness program online during the lockdown periods, but I want to compact that into a weekend. And so it keeps me going. It really is very fulfilling because I believe in my work. And what I've realized is that, nothing shifts until you bring your own passion and energy into it.
Absolutely beautifully said. And before we leave you, how can we stay in touch? How can people find out more about this retreat, stay in touch with what books are coming out in the next few months? Where can
So
we find you?
yeah, best is my website, drarundhir.com. That's where I put out most of my work, which is related to health and well-being, mind-body connection, and any retreats that I'm doing, including my books. I also have a YouTube channel in which I put out some weekly videos. Once again, the purpose of all these videos is not to try and sell people something, because people are really smart and intelligent these days. They know exactly what they're looking for. But on the same token, they are confused as well because they're getting so much information from everywhere that it is hard for them to make a decision. So they're looking for a genuine source of information. And I think that's what our role is as medical practitioners, as members of bodies like ACNEM, is to provide value-based information, evidence-based information to our audience.
And before we leave you today, Arun, you mentioned quite a few things: meditation, yoga. How do you keep yourself from preventing burnout? What do you do?
Oh, that's such a big thing, Shami. And the only thing, and I was reflecting on this only a few days ago, that all through this lockdown that started from March of last year, and being a surgeon, elective surgery was the first thing that got the sort of cut. So I had to sort of shut down my practice. The staff was working from their homes. It was very turbulent. It was very unpredictable. And the only thing that kept me going was my morning routine. That is my pillar. I get up at 5 in the morning. I've got about 40 minutes of meditation that I do. After that, I would do yoga. And then I would go for a run or an exercise, some sort of a cardio thing. Besides that, during the lockdown phase, I became very regular in producing YouTube videos and also running the Radical Wellness program, which we were running on Zoom. So every Sunday morning, we would be doing a yoga class. Prior to the yoga class, I would give them a 30-minute presentation on PowerPoint. And we go from the mind to the body, to the gut, to the heart, and then to the soul. This is about creating a process of healing. So I've got some details on that on my website again, if anybody's interested.
So just a few things then, Arun. It's brilliant, absolutely. And what an inspiration, actually. I think we do need to look after ourselves as practitioners. We don't talk about it more, and we need to. We need to address it. We need to be vulnerable so more people learn about it and do something about it. So thank you so much. Now, before we leave you all today, nutritional medicine is not taught at med school, and it's now more important than ever to educate ourselves in this field. So thank you so much, Arun, for your inspiring work. Don't stop, and can't wait to see more of your work.
Pleasure. Thank you again, Shami, for the invitation, and lovely to speak to your audience.